So, this is, as you know, and with all of our patients that we work with, it can be a very delicate issue, especially when talking about a degenerative disease. So what do you usually tell people or their families, the families of individuals who are demonstrating signs and symptoms of primary progressive apraxia of speech?
Yeah, well, it's a good question and an important one. When I see a patient whose neurologic workup has ruled out other possible causes, and it can be concluded that something degenerative is going on, what I'll usually discuss with the patient and their family is that we have to conclude that there's some neurodegenerative process going on in the areas of the brain that plan and program speech that are not prominently involved in other cognitive or motor functions, which is why the problem is isolated. And that it is maybe comparable to the way they can think about it is that that area of the brain is aging more rapidly than are other areas of their brain. I think it's important to convey that this is an unusual problem or an uncommon problem, but probably not as uncommon as many people think, because it often gets another label. So, for example, many patients are worried that this is the initial manifestation of something like Alzheimer's disease. And patients can typically be reassured that the probability that this speech problem represents Alzheimer's disease is very, very small. So those are some of the important things I think that need to be conveyed.